this video, I'll be telling you what ingrowing hairs are, why do we actually get them. I'll tell you about the 2 different types of ingrowing hairs that you can have, tell you how to cure it, how to prevent it, and also I'll give you some tips about how to modify your hair removal techniques so that you're less likely to suffer from ingrowing hairs. Hi ladies, I'm Dr. Simi, former surgeon, current GP and cosmetic doctor. Welcome to my channel where we discuss all things skin and women's health. In today's video, we're going to be discussing ingrowing hairs. And the medical name for them is actually pseudofolliculitis. Well, they're also known as shaving bumps or razor bumps. You tend to get ingrowing hairs in places where the hair is quite thick or coarse, such as the underarms, pubic region, beard area or legs. Pseudofolliculitis is due to inflammation of the hair follicle or the skin around the hair follicle because of an ingrowing hair. So there's no infection, it's just that the ingrowing hair is causing the irritation and the inflammation. And the trigger for this is our hair removal practices. So I'm talking about shaving, waxing, plucking, tweezing, and I know that I'm definitely guilty of, I was going to say one, but I actually think all of those hair removal methods. So how do you know if you're suffering from ingrowing hairs? Well, classically, there'll be a history of hair removal. And then maybe 3 or 4 days later, you might notice that you've developed a rash, which is itchy. It can be red. It can be irritated. In skin of color, it can just be kind of dark or skin colored bumps. And sometimes these develop whiteheads on them. When this rash heals, you can sometimes be left with what we call papules, which are firm lumps in the skin, and they can take months to resolve. So because of that, some women think that they've developed acne in that area or that they have an infection when in fact they have ingrowing hairs. As that progresses and the spots heal, sometimes you develop post-inflammatory hyperpigmentation in the areas where the spots were. In some women, if the irritation is enough, it can cause scarring in the form of keloid scars or hypertrophic scars. So ingrown hairs actually affect all ethnicities and it affects men a lot more, but us women also suffer from ingrowing hairs. There are lots of different factors that add up together to make you more likely to have ingrown hairs. The first thing is how curly your hair is. The hair follicle in skin of color tends to have a wavy passage through the skin, and this affects the shape of the hair. So the hair follows the shape of the follicle and will come out curly. So having curly hair means that the hair is more likely to grow back into the skin and be ingrowing. Also, studies have now shown that there's actually a genetic component to having ingrowing hairs because of a change in the gene sequence of keratin, which is a protein that's contained in hair. And finally, the real trigger or the thing that sets you up for getting ingrowing hairs is how you are removing those hairs. So if you are shaving, that's a really big trigger. If you are plucking the hairs or tweezing or using sugaring, all of these methods increase your risk of having ingrowing hairs. Okay, so let's move on to the 2 types of ingrown hairs that you can get. The first type is called extrafollicular penetration. So you get this type of ingrown hair typically if you have shaved your hair. Shaving kind of cuts a little bevel to the hair, so you have a sharp tip. And this means that as the hair grows out, especially if it's curly, it will kind of bend over, and that sharp tip will pierce the skin next to the hair follicle and it will grow down in there. Now, hair's not supposed to just grow randomly in the skin. It has kind of dedicated channels that it's supposed to grow in, i.e. the hair follicle. So when it's just growing randomly in the skin and outside of a hair follicle, your skin sees that as a foreign body. It thinks, wow, this shouldn't be here. And it tries to attack it and to try to remove it. So that foreign body reaction is what gives us the symptoms that we classically associate with ingrowing hairs. That's the itching, the redness, the irritation and the bumps. And if you've got skin of color, that irritation will irritate your melanocytes and they respond by throwing out more pigment. So you'll notice if you've got skin of color and you've ever had ingrowing hairs that usually you will get dark marks in each of those areas where you've got the ingrowing hairs, or you'll get the bumps, which we call papules, and when they resolve, you're left with a dark mark. The second type of ingrown hair that you can get is called transfollicular penetration. So in this type, which you classically get if you pluck your hair or you tweeze it or wax in, for example, part of the hair is left inside the follicle underneath the surface of the skin. As that hair grows and it tries to make its way out of the follicle, it just can't do it. And it starts growing through the follicle wall and actually out into the skin that's next to the follicle. And sometimes it will even curl itself up as it's trying to grow out. In this kind of situation, the skin develops a lump that can be irritated and tender because there's hair growing underneath it. Again, this is going to cause that same foreign body reaction. It can actually cause other complications that are worse than the ingrowing hairs. So for example, true folliculitis, which is inflammation of the hair follicle because there is now a bacterial infection in there. So this looks like painful red spots if you've got Caucasian or lighter skin. In darker skin types, it might just be irritated. You might not see that redness as much, and it can be really itchy and tender. Sometimes it can be difficult actually to tell the difference between the pseudo folliculitis barbae and the true folliculitis. One of the clues though is that if you have a folliculitis, sometimes each of those individual spots develop whiteheads, which is basically pus from the bacterial infection that's there. So if you see this, that really needs antibiotics. So I would see your doctor for a prescription. The other complication that can happen, we've already talked about, is hyperpigmentation. So anything that irritates skin of color can lead to hyperpigmentation. Also, the irritation that can occur in the bikini area on the underarm can be really difficult not to scratch the area. It's not a good look going around scratching your bikini area, so it can be awkward. It can be socially, should I say embarrassing or should I say unacceptable to be scratching the bikini area? Probably both. Okay, so I know what you're thinking now. You're like, okay, Dr. Simi, that's enough. I just want to know, how do I cure it? You can cure it, but you might not like what I'm going to say next. You need to stop certain hair removal practices. So that's shaving, waxing, sugaring, plucking, tweezing, all of those ones that I mentioned before. Now, before you switch off the video and you're like, Dr. Simi just tried to tell me that I can't wax or shave my pubic region or my underarms or my bikini area, I'm not watching this video anymore. Don't shoot the messenger. It's not my rule. It's just that studies have shown that if you stop shaving or stop those other hair removal practices that I've mentioned for a month, so about 30 days, you will allow the hair to grow, and once it reaches about 10 millimeters or a centimeter, the problem tends to resolve itself. Usually, for some reason, that's enough for the hair to be able to extract itself from the skin, and also it gives time for those papules, which are the bumps, to improve. And I know that for many women, that option is not a great one because it's not socially acceptable to kind of have hairy underarms or hairy bikini lines or hairy faces as women. So the next best option to cure this is laser hair removal. So the reason why laser hair removal cures this is because it destroys the hair follicle. It actually prevents the hair from growing back, or it will kind of damage it so that the hair that does grow back is kind of like the really thin peach fuzz hair, like baby hairs. So that kind of hair is just so soft, it can't really penetrate the skin in the same way, and the problem with the ingrowing hairs is resolved. Now, for many people, laser hair removal, might be out of the question. It's expensive. You need more than one session, and that's because the laser actually targets hair that are in the growing phase of the hair cycle. So at any one time, a certain proportion of your hair will be in the growing phase. Laser hair removal will reduce those hairs, but for the other hairs that are in the resting phase, it won't work for those. So the way that lasers work is that they target the melanin that's in the bulb region of the hair follicle, and they destroy the follicle so that the hair doesn't grow back or is less able to grow back. This means that the ideal candidate for laser hair removal is actually somebody who's got fair skin and dark hair, because there's a really good contrast between the target for the laser and the rest of the skin. But in skin of color, there's more melanin in the skin, so the laser can get confused and it can try to target the melanin that's in the hair follicle, but by accident it can also target the melanin that's in the surrounding skin. And this is why certain lasers are not good for black skin, and they can cause problems with burns, scarring and hyperpigmentation. It doesn't mean that women with skin of color can't have laser hair removal or can't have treatments with lasers. If you're interested to learn more about lasers in general, how they work, and also which lasers are safe for skin of color, then comment down below and I'll happily do a video about this too. Okay, so let's say neither of those options are for you. You're like, there's no way I'm stepping out of my house without waxing or shaving, and there's no way that I'm spending X amount of pounds or whatever your currency is on laser hair removal. So what other options have you got? Chemical depilatory creams, so these hair removal creams, they're less likely to cause ingrowing hairs. So they work by breaking the disulfide bonds between the hair shaft, and they basically weaken and soften the hair. You might have noticed if you've used them before that when you wipe off the cream, the hair it's almost like it's frazzled or melted, and it comes off really easily. When you remove hair in this way, the tip of the hair is blunt, or sometimes it's even feathered when it grows back. So because it's so weak, it just cannot penetrate the skin in order to cause ingrowing hairs. But one of the downsides of using these creams is that they can be really irritating on the skin, and for skin of color they can actually cause hyperpigmentation. I know from personal experience that whenever I use these creams on my underarms, I would get hyperpigmentation of my underarms, and that usually lasts several weeks. I often get questions about these devices that are sold as home laser treatments and whether you can use those and whether they prevent ingrowing hairs. So you can use those, and some women do find that they actually help reduce the amount of ingrowing hair, but because the output from them is obviously not as strong as having a laser treatment in a clinic, they're not going to be as effective. Make sure that you check that they are suitable for your skin type and for your hair, as I mentioned before. For those of you who are like, well, I'm really happy with shaving, I get good results, but I just want to know how to reduce the ingrowing hairs. My recommended skincare routine or hair removal is, before you shave, pre-soak the area. So this means shave after you've had a shower or a warm bath, so that the hair has actually absorbed the water and has had a chance to swell. This means that when you actually shave, you'll be creating a blunt edge and not a sharp edge to the hair, which increases the chances of the hair piercing the skin and being ingrowing. And I know that some of you will be like, I'm about to head out of the door and I've just noticed that I've got hairy underarms. I'm not getting in the shower. That's fine. All you have to do is just soak a towel or like a face cloth in warm water and just hold it on your underarms for about 3 to 4 minutes, just enough for that hair shaft to get soft, and then you can shave as I've explained. For waxing, I prefer the opposite. So wax before you have a shower, but also avoid moisturizers on your skin so that the wax can really grip to the hairs. When you're shaving, use a shaving cream, or you can use like a gentle cleanser, because this helps with the slippage. It helps to reduce the friction. It helps to reduce irritation when you're shaving. And it also helps to reduce the chances of getting tiny cuts and nicks on the skin, which can actually promote hyperpigmentation. Whilst you're shaving, avoid kind of stretching the skin and pulling it taut. This is because when you let go of that skin, that hair that you've just shaved retracts back into the hair follicle. And if you're somebody who's prone to having ingrowing hairs, then when this tries to grow, it could actually end up growing inside the follicle as an ingrowing hair. After you've shaved or wax, use a moisturizer that's bland and that doesn't have perfume, because shaving and waxing is likely to have caused tiny cuts and irritation to the skin. Using glycolic acid on the skin as a moisturizer can help with ingrowing hairs, but definitely I wouldn't do it after shaving or waxing, because remember that you're going to have done a physical exfoliation just by shaving. I would wait sort of 3 to 4 days before you start using a moisturizer that contains glycolic acid in. Also, before having your wax, you can use paracetamol and antihistamines 30 to 45 minutes beforehand, which will help you with any pain and also that itchy red rash that you can get immediately afterwards. There are other ways that we can treat ingrowing hairs as well. So if you see the ingrowing hair and you can almost like see the loop, you can, if you're really careful, just pass a sterilized needle, just clean it with an alcohol swab, or you can use a sterilized toothpick just to lift up that hair. You have to be really careful though, because you don't want to be poking anything into the skin. You just literally want to catch the hair and lift it out. And that can sometimes be enough to stop the irritation. If you're going to opt for in-clinic treatments, chemical peels containing salicylic acid or alpha hydroxy acids can also be helpful because they exfoliate the skin that's trapping the hairs. Try and also avoid using products that contain perfumes or alcohols. These will definitely irritate your skin when you've just shaved or waxed the area. If the ingrown hairs are causing you a lot of inflammation and redness, you can buy over-the-counter hydrocortisone, which is a weak steroid, so 1% hydrocortisone, and you can use that as a spot treatment on each of those individual spots. Or if you've got an area, you can just apply a really thin layer to the pubic region or the underarms, and it just helps to calm that inflammation and the redness and the discomfort. Because ingrown hairs affects the hair follicles, you can actually use treatments that we would use to treat acne. So benzoyl peroxide, for example, has really good antibacterial or antimicrobial activity, so it can be helpful for treating ingrown hairs, especially if you're getting kind of inflammation in that region. And also tretinoin, which is a topical vitamin A derivative, can also be useful because it helps to exfoliate the dead skin cells that can be trapping the hair. If there is a lot of inflammation associated with the ingrown hair and it also looks like there's infection there, then we sometimes have to go down the route of oral antibiotics to help to clear that infection. There is a prescription medication that's available, and it works by slowing the rate of hair growth. So certain women find it really useful. So for example, if you use the cream and you also use laser hair removal, or if you use the cream with other forms of hair removal. So I hope that I've covered everything and that you found that video useful. If you have, please share it. And of course, if you've got any questions or you want to share your experiences, jump in the comments section below and let's have a chat about it.